ladies and gentlemen. I'm so happy to be here today, and I think what I'm going to talk about pretty much sums everything up. But the city I want to live in. So I'm going to talk about how Reykjavík has been working towards well-being in the last years. But in 2020, we had our, this is what we call our Green Deal. And this works kind of as our compass in our work in Reykjavík. This is our strategic plan, and it's leading Reykjavík's 13,000 employees towards a future vision of a healthier, greener, more equal society that offers quality services and a vibrant economy without wasting natural resources. These are pretty high goals. But the ultimate goal, of course, is to enhance the quality of all of our residents. So the Reykjavík's Green Deal is based on the 3 pillars of sustainability. It's the economic, social, and environmental. And this then works kind of as our master plan towards sustainability, and therefore the well-being of all. So we have these 3 dimensions in the Green Plan. We have the green city, and then we have the growing city, and we have the city for people. In the green city, we have, for example, reduction in greenhouse gas emissions. We have eco-friendly transportations. In the growing city, we have, for example, responsible financial management. We have a good environment for the economy and innovation. And for this, in the city for people, which I will be focusing on, we have improved public health. We have cultural arts combined with city life. We have the education, which is under the Let's Make Dreams Come True. And the city for people is for all of us. So these are our goals for Reykjavík's city, the city for people, where Reykjavík is founded on justice, fairness, and the participation of children and adults, where residents can live in safety and can have a positive impact on their own lives and the lives of others. By listening to and sharing with one another, we contribute to an equal community open to all. So these are pretty high goals, but this is our vision. But how do you know if we are on the right track? We know where we want to go, but what are ways to measure if we're going in the right way? So I think we have talked about today and yesterday about how we in Iceland are data-driven. We are collecting the data, and these are, for example, we are collecting this data. The measure of success in the Green Deal, the Reykjavík City implements 3 standards from the World Council on City Data, and these are the standards. And this week, the data service for Reykjavík is opening a data portal to ensure that all data appears there with the aim of maximizing utilization and increasing transparency. Among other data, the city's sustainability indicators in relation to the Green Plan will be published there. But this is work that is, we are implementing these standards, but we are still working on it, how we're going to use it, how we're going to use this data to improve and read how we're doing. So, but we want for our practitioners, our staff, and everyone to use the data. So we are trying to make it possible to have, so that everyone can have access to it. And I think that's our goal as a municipality, to, so everyone can see what we're doing and what we're aiming at. So the public health policy is one aspect of the Green Plan. I think, but it's a very important one in relation to what priorities are being discussed at this forum. It was an important step towards the well-being when the policy was adopted. And the strategy is across the city sectors and is intended to cover the main influencing factor of health and well-being. So these are the principal aims and priorities on the social health factors. And I'd like to mention that the public health policy was, we were working very closely with our colleagues, with the Director of Health, with the help of Dora and Gia. And so we have these three principal aims, and then we have the three sub-goals under each one. So we have the improved health and well-being at all stages of life, where we have a health-promoting city, a model city in risk prevention. We have the urban development for human health and the planet. Then we have the equality for health and well-being, where no one is left behind. There we focus on equality, the participation of all, and secure and peace. And health and well-being is a guide in all of the activities of the City of Reykjavík. That means, for example, a cooperation with the Directorate of Health for a health-promoting city. That means our cooperation in the Healthy Cities Network, Shirin was telling us about earlier. And that means also that the public health measure is based on data and regular measurements. And last but not least, the sustainable well-being economy. So, the Reykjavík, like I said, is both, has been like in a close cooperation with the Directorate of Health. And we have gained a lot from being a member in the health promoting community since 2013. And also Reykjavík has been a part of the Who Healthy Cities Network since 2019. And in my opinion, it's given us an opportunity to bring the well-being and health into more sectors in the city. The public health in Reykjavík has focused on health promotion and prevention, but I think we are taking more steps towards bringing our public health policy really into more sectors, and we are feeling that both people within the city and like internally and externally, people are, I think, starting to realize how much importance the public health is in all our actions. So, and also I'd like to mention, being a part of like networks like these, it gives us an opportunity to measure ourselves with other cities, with other municipalities, and have the discussion that is very fostering to the work we are doing. So with the public health policy, we presented the public health policy at a time marked by the COVID-19 pandemic. So we know how that has affected our environment. We know how that's affected our residents for the short term, but the long-term effects are still very unclear. But I think we are now renewing it for the first time, and hopefully, and I can say, like, and from the discussions just here, our focus will be on the well-being of all and on the mental health and social factors. So annually we publish the city health profile or the public health indicators for the city. So this is just an example of, it's in Icelandic, so, but this is an example. But in the city health profile, we focus on lifestyle, children and youth, environment, infrastructure, equality, and healthy aging. And I'd like to mention we are also a part of a healthy aging communities. So, this, for example, we have children and youth. And then we pick out special indicators that we are measuring the well-being, health, and lifestyles of our youth. And we are tracking what we experience to be the most challenging factors in their lives at the moment. So they can, it's variable between years what we are measuring, but I think this is very important both for everyone to see and also for the people who are working close with in the communities. So in Reykjavík, and hopefully I'll get a chance to talk about that a little bit more later, but we work in a team. We work, I'm located at the mayor's office, but of course we have so many people working in the service centers who are doing most of the job. They are working closest to the people, and I think when we put out a policy, sometimes in the municipalities we get no funding, we get no money with it. They say, you should do this, we're going to aim for this, but you might not have any money to do it. So, but I think I want to make an example that little can do much. Because we had this public health fund, an experiment project that we are running through the service centers. The amount is based on a population under each center, and it gives us an opportunity to talk about our public health policy, our well-being of the residents. We have a discussion with the stakeholders, the school, the leisure, sports clubs, everyone basically who has something to do within the community. And so like in this, so we are funding like small projects that are aimed for the well-being of the resident in each district. And this, for example, is a picture from Kjalarnes, which is a suburb in Reykjavík. And here we see a group of elderly taking part in a structured physical activity. When we started, there was nothing for there was no option for them to take part in a structured physical activity. Now we have over 17% of elderly people in Kjalarnes taking a part in these lessons. So we were able to fund it, start it, and hopefully now it's sustainable. Hopefully now people will come and see there's an opportunity for this, and this will be sustainable. So this is just an example of how little can do much, and I think it's very much in line with what has been discussed here today, to take the people into the conversation, to make them realize what it's about and why we are talking about their welfare. And last but not least, I would also, in relation to that, so the project, they arise from conversation and the need in each city. So this is an example of a youth conference that was held here in Harpa in a bigger room, because there were 600 of them. Teenagers from 9th grade in the East District of Reykjavík. They met here and spent the whole day to discuss their challenges. They had the police to come over. They were discussing what the police was doing for them, how they could approach some challenges they're facing in relation to violence and social media and so on. So I think this is like the future. I've talked about the future vision for Reykjavík, but I think when it comes to all, it's really about the people and how we can enable the grassroots into the conversation towards well-being. Thank you.